So you briefly touched on this. When speaking to a doctor, what should patients with cancer be asking?
I think the first thing I would say is that when you're diagnosed with cancer, you are going to find it really hard to take on board all the information. You are still reeling from the diagnosis. You're thinking, oh my gosh, am I going to live? Am I going to die? What about my family? What am I going to do? They're going to tell you about the treatments and they want to inform you about them. But you don't take much in because your mind is a whir. So they will tell you what they believe are the most important things to tell you. And they will really emphasize things that are common that we see. For example, if you give someone chemotherapy, their immune system gets damaged and they're not able to fight infection as well. So you'll be told very much what to do if you get signs of infection, that you must get into hospital quickly. They don't always emphasize the risk of blood clots. So I think you have to say, what is my risk of blood clots? What are you going to do to help minimize my risk? And if I have symptoms of a blood clot, what should I do? I think we need doctors, nurses, cancer specialists need to take responsibility for this as much as we wish to empower patients to ask about it. Now, I want to be clear, I am not making out one moment that our cancer specialists don't take clots seriously. But clots are one of many complications of chemotherapy that they will have to cover. And it's one of many complications of chemotherapy that they need to identify and treat. So it's easy for me talking about clots being the most important thing because this is what I spend my clinical practice managing. But what I do know is this: blood clots are the commonest cause of chemotherapy-related death, not infection. The rate is the same as infection. And so therefore, if we are looking at preventing mortality, preventing death from chemotherapy, we need to be giving the same level of attention in preventing blood clots and acting on symptoms of blood clots quickly as we do for infection.